Alright, so when you get your braces on, I'm going to go over some quick essential guidelines and tips that will help you take care of your teeth and achieve the best result possible. Dr. Andrews provides you with an electric toothbrush. It also has a toothbrush head, which is orthodontic head. The bristles are a little bit longer and it has some bristles in the center. What you want to do when you brush is the electric toothbrush will vibrate and also rock back and forth. You want to make sure that you are helping it by angling the bristles way back on the very back teeth and brushing in a circular motion. The circular motion will help you guide those bristles up underneath that wire and get those bristles underneath it, and also angle down and do the same thing. When you brush, all the way in the back, side to side, top and bottom, you also can't forget about those teeth on the inside. So you want to brush on the inside of the teeth, on the very inside where your tongue is. Don't forget about those teeth down in the front, especially on that lower area. It usually seems like an area that most people miss. Brush the top, inside of the teeth, and on the very inside as well. When you're all done brushing, I want you to take your toothbrush. If it's your electric toothbrush that you're using, turn it off. You can use your handy dandy or travel toothbrush, or you can use your electric toothbrush. What you want to do is just rinse it, get the bristles nice and warm, and just gently brush over your gums, just with a little bit of pressure. That's going to help stimulate your gums and keep them really nice and light pink and keep them healthy. This little guy, we call it a Christmas tree toothbrush. It's actually an interproximal toothbrush. This will help you get underneath that wire and scrub on the insides of your teeth. Sometimes when you eat a lot of sticky foods, breads and tortillas and things like that, you'll get some areas where it just sticks and clings to the teeth. If you use this guy after you brush, just look in the mirror for the areas that you missed and help get in there with this little guy. It is very important that you still floss, try to floss each day. What you can do is tie a piece of floss to the blue threader in a couple knots. The threader will just make it a little bit easier to get underneath the wire. So you'll put it underneath the wire like a needle and thread, wrap it around your middle fingers. When you floss, you want to go down in between the teeth, kind of do a scooping motion, and then come back up in between the same two teeth, go back down again, do a scooping motion on the opposite side, and then pull it all the way through. And then continue by going to the next, in between the next two teeth. Another great investment is to have a water pick. The water pick is the next best thing to flossing. It's not the best, but it's pretty dang close. What you can do is fill the basin with some warm water, turn it to medium speed. You want it to feel like it's flushing out your gums with a stream of water, like if you had a squirt gun for your mouth. You don't want it to feel like it's slicing, and you don't want it to feel like it's just drizzling some water. So what you'll do is you'll take your water pick, you'll angle it towards the bottom of the tissue and kind of follow your gingiva around the teeth. Also, where your tissue comes up into a point, you can angle it down and kind of flush it out and squirt around in between the teeth. We give you some disclosing tablets. What you can do is chew up the tablet, swish it around in your mouth, spit in the sink a couple times. What it will do is it will stain any bacteria that you missed in your mouth a really hot pink purple color. So you'll want to go back and brush your teeth again and really focus on those areas and spend a little bit more time. This is called a bite wafer. It's a flavored piece of plastic. If your teeth are ever tender or sore after you come in for a new wire change, you can take this, put it in between your teeth. What you want to do is just kind of clench on it for about 20 seconds. So squeeze on it really tightly. It'll allow the blood to go back through your teeth and it'll make everything a little less tender. Now, if you have any areas or teeth that are a little rotated and the bracket is rubbing against your lip, what you can do is you can use a couple different ways to get out of discomfort. You can take a piece of wax. We give you two different kinds. One is a little bit thicker and this one is a little bit clearer, but they both do the job. So if you have a little area that's bugging your back of your cheek or your lip anywhere, you can take the wax, roll it into a ball, stick it on the area that's bugging you, kind of use your finger and roll it around. If you notice that when you push it, the wax comes off, lick your finger and then push it on there again, and what it will do is it will help it stay. You can also push on the outside of your cheek, and that will help it stay as well. You're more than welcome to reuse it eat with it in. If you eat with it in, make sure you pick it off and throw it in the trash. We provide you with this magnet. It gives you a list of absolutely no's and sometimes foods, and also some problems and home solutions. The absolutely no's are absolutely no popcorn or gum. The popcorn will get stuck up underneath your wires and in between your teeth, and they'll cause abscesses. The gum is another absolutely no, and what it will do is it will get stuck in the brackets and it will prevent the doors from closing correctly, and it will allow the wire not to do its job and slide freely in those brackets. So please don't chew gum. Some foods on here on the absolutely no's you're going to see, and they're healthy foods such as apples, carrots, corn on the cob. You can still have those foods. We just recommend that you cut them up nice and small into bite-sized pieces. Anything that you bite into, like an apple, those are the foods that you want to tear up or cut up into small bite-sized pieces. We give you this little card. What we want you to do is look at the pictures and read over them. We grade you every time you come in for your appointment, 1 through 5, 5 being the best, 1 being the worst. What happens is if you don't use all these tools to help keep your teeth really nice and clean, is you'll end up with a smile with straight teeth, but you won't want to smile because you'll have decalcification around where your brackets used to be. Right here, this picture shows you that the bracket that is glued to your tooth actually protects your enamel. It keeps your tooth really healthy and clean underneath it, but if you don't do that around the bracket with proper brushing and flossing, what it will do is it will start to break down the enamel, making it weak, and it will start to decalcify, which we call it scarring here, because like a scar on your body, it doesn't go away. Once you have a scar on your tooth, you can't bleach it out, you can't brush it off, it is permanent. Also, if you look at this picture right here, this will show you a smile with your teeth the same color as they were the day you walked in here. And also this is a smile that they didn't brush very good. They didn't get those bristles angled up and down to keep the teeth clean around the gums. So their teeth started to break down a little bit around the brackets, and then they have these white spots which don't look very good. So we want you to have the best smile possible. So we know that braces are new to you. If you have any questions or concerns or problems, please feel free to call us at any time. And we can't wait to see you again.